Hi, everybody. Welcome tonight. And so if you guys want to engage with us, you can tweet hashtag Gen Weekly, or you can just go ahead and chat with us in the chat on YouTube, and we will bring your comments and questions into the fold. Thank you so much for being here. So first up is a little bit about the Affordable Care Act. Each week, as you may or may not know, we pick 3 or 4 topics, hot topics from the previous week, and talk through them. So first up will be Trump on the Affordable Care Act, also known as Obamacare to a lot of people. Our slideshows will come at the end of our videos. When we put them on YouTube, we'll put links into these slides so that you guys can view them, and all the slides have links on them too to our sources and to other information that we're bringing up. So first off, Trump on his interview wants to keep 2 important provisions for the Affordable Care Act. One is for pre-existing conditions, and the other one is about children staying on their parents' insurance past, or I think it's mid-20s. If you guys know the actual age, please let me know. So in addition to those 2 provisions, he also said that he would not repeal the act unless there was another plan in its place, inferring that people wouldn't go without health insurance. I thought I think repealing the law might be a little bit far as far as what they need to do. I think that they'll have a strong fight on their hands in order to do that. But then I was curious, and I said, I'm going to go back and let's look at Trump's plan. And of course, the tagline is healthcare to make America great again. And there are several provisions that they outline for their campaign and what they wanted to do. One is repeal Obamacare, obvious. It's the one that everyone knows. 2 is that to sell health insurance across state lines. Kara or Ryan or Sean, any opinions on any of these? Please just kind of interrupt me or check in at the end, however you feel comfortable. The third one, they're going to allow individuals to fully deduct their health insurance premiums from their taxes on an annual basis, allowing individuals to use the tax-exempt HSAs or health savings accounts. They want some price transparency from providers, so it sounded like they were going to put some things in place there that would force doctors, hospitals, not force, but require hospitals, doctors, institutions to be more transparent about their pricing structures and strategies. Medicaid block grants for cities and states, and then removing barriers to entry for drug providers so that more industries can provide, if they can provide good quality pharmaceuticals at a lesser cost than other more brand name companies, then they would be in favor of stuff like that. So what are your guys' reactions, one, to his interview and what he's saying about what he would do with the Affordable Care Act, and then 2, maybe talk a little bit about some of his provisions and your thoughts on them?
Well, as far as I am concerned, the interview was, I don't know, in some ways you could find it at least a little more nuanced than I expected, maybe. So he's at least starting to do his homework and finding, obviously, that everything's a little more complicated than it might look on the surface. But it's still maybe a little too early to really know what's really going to get done, because clearly, as we've seen in the last couple of days, he really didn't know what he was getting into. So I think maybe everything is still just to be taken with a grain of salt. I mean, this is besides the fact that he seems to be a pathological liar, just because he just doesn't really know still what he's getting into. As far as particular parts of the plan go, I'm not too educated on any one thing or part, but to me it seems like what he's basically doing is just listening, obviously, to the people that he's surrounding himself with and kind of tweaking it back towards, I'd have to look to more of maybe what like Romney Care was. So I'd be interested to see between the 3 plans, between the ACA, whatever Romney was doing statewide, and what he's hoping to do, and to see those changes and what they mean. At least we would know with Romney Care and Obamacare or the ACA, we would at least see numbers get statewide and national numbers. So, but it might still be interesting.
The one thing that stuck out to me, the one stipulation, was the being able to buy insurance from out of states. I'm really curious to learn more about that, because with HMOs right now, and I've had trouble with being out of network like 30 miles away, and with there being thousands and thousands of insurance companies, how's that going to work for coverage if I in Wisconsin want to buy insurance from an insurance company from Nevada or something like that? I really don't understand how that coverage is going to work. And then my fear, my long-term fear with that, is that it's a ploy to really monopolize even more the health insurance industry, because then you start building it up to like the media, where you have 6 main insurance companies that everyone across the country can buy. And so I don't really understand how that's going to increase the competition and drive the pricing down.
So one take on that from mine, only because I like that provision of companies being able to cross state lines. So what that tells me, though, is that right now they're not allowed to, and that to me, that decreases competition. Now, I understand that it might create monopolies down the line, which is kind of like where we get with our current communications companies, telecom companies, and content providers. But I also think that there is a need right now to figure out who are those companies that are going to provide the best services. And maybe there is a company in Nevada that that might be more diligent in taking care of the needs that you requested, Ryan. You might be able to find a company in another state that would actually provide better insurance than what you currently have, if a provision like that was to be taken under.
Well, I don't understand. Okay, so I am Milwaukee based in Wisconsin, and through the Affordable Care Act and not knowing much about shopping for insurance, I ended up buying insurance from an insurance company that is based out of Madison, which is about 90 minutes from me, and had a lot of trouble, couldn't go to my normal doctors because I was out of network. And so if that's a 90-mile distance, how do they cover people hundreds or thousands of miles across the country?
I see what you're saying. You're saying if a company 90 minutes away can't, if a company 90 minutes away can't manage it successfully to get you the care that you need, how is someone in a different state going to be able to do it?
Exactly.
Yeah,
that's
I think
my concern.
Mm-hmm. My hope would be that those companies that provide that service, that they would gain traction because of their track record, and so they would be able to grow and do things that way. I think it really depends on the people that are managing those organizations. But I see what you're saying.
Yeah, and to be honest, my main concern was the pre-existing conditions and not having a period of not being able to be covered. So, like Sean was saying, I think he listened to people and had some people whispering in his ear about what you can actually manage to do with repealing Obamacare.
Yeah, and there's even some more stuff out there, and this won't be the first time that we talk about the Affordable Care Act with everybody, but they're in for a fight, even if it comes down to Congress filibustering or other different strategies for repealing. There are some provisions that are just going to be almost impossible to repeal. So it should be very interesting. Go.